Hello there, my friends. I am Dr. Richard Miller, a physician who has spent the last 15 years caring for thousands of patients just like you, many of them in their 60s, 70s, and beyond. If you're watching this today and you have been living with a type 2 diabetes diagnosis, I want you to do something for me right now. Take a slow, deep breath in through your nose, let it out gently, and lean in. I know the fear that comes with this label. I have sat across from people your age who worry they will lose their independence, who wonder if they will ever chase their grandkids around the yard again without feeling exhausted, or who lie awake at night thinking about what the next complication might be. I'm here to tell you that the story we have been told for decades is changing, and it is changing in a way that gives real hope. For years even, I was trained to describe type 2 diabetes as a chronic progressive disease that you simply manage like a companion you learn to live with. We focused on prescriptions, on blood sugar logs, on steadily increasing doses as the years went by, but science has now shown us something far more encouraging. For a great many people, especially those who act with intention, this condition does not have to be a life sentence. It is a metabolic state that can be reversed. And I have seen it happen time and time again in my own practice. Now, let me be direct with you the way I would be if we were sitting together in my office. When I say the word reverse, I'm not offering you a miracle pill or some overnight cure that sounds too good to be true. What I'm talking about is something deeper and more reliable. I'm talking about returning your blood sugar levels to a healthy non-diabetic range, often without needing the same medications you may have taken for years. This is not guesswork. It is grounded in biology and how your body stores and uses energy, and in the remarkable capacity your body still has to heal when we remove the burden it has been carrying. I want you to imagine your body as a wise old engine that has been working hard for decades. It has gotten you this far, it has raised families, built careers, traveled roads both easy and difficult, but over time that engine can become overloaded. Let's talk about why this happens in the first place, because understanding it takes away some of the mystery and the fear. When you eat particularly foods that break down quickly into sugar, your blood glucose rises. Your pancreas, a remarkable organ tucked behind your stomach, responds by releasing insulin. Insulin is like a key that opens the doors to your muscle cells, your liver, and your fat tissue, so the sugar can be used for energy or stored safely. In type 2 diabetes, those doors become rusty and resistant. The key still fits, but the lock does not turn as easily. So your pancreas works harder, producing more and more insulin until eventually it begins to wear out. Sugar stays in the bloodstream longer than it should, and over time that excess begins to damage nerves, blood vessels, eyes, kidneys, and the heart itself. For too long, we have reached for more keys, meaning more medication, without addressing the overload itself. Medications are life-saving tools. I prescribe them every single day, and I will never tell you to stop them on your own. But they are not the whole answer. The real question we should be asking is this: if your body is carrying too much stored energy, particularly deep visceral fat around your organs, does it not make sense to help your body release that burden? Because when we do, something almost magical begins to happen. The rust starts to clear. The locks begin to work again. The pancreas gets a chance to rest and recover. I have watched this process unfold in patient after patient, and it never stops moving me. Let me tell you about a man I will call Harold. He was 74 when he first came to see me, a retired high school principal with a gentle sense of humor and a deep love for his 5 grandchildren. He had been on metformin, then a second medication, then insulin at bedtime for nearly 12 years. His A1C was stuck around 8.2 despite his best efforts. He looked at me that first visit and said, "Doc, I just don't want to be a burden. I want to be able to take my grandkids fishing without worrying about my sugar crashing." We did not start with a list of restrictions. We started with respect for his life and what he wanted to be able to do. We created a structured plan that focused on nutrient-dense foods, on giving his body predictable windows of rest from digestion, and on gentle but consistent movement that fit his needs and his schedule. Within 4 months, his blood sugars were trending down dramatically. By month 7, we were able to reduce his insulin, then stop it completely under careful supervision. At his 1-year follow-up, he walked into the office carrying a string of trout he had caught himself. His eyes were bright. His energy was back. He told me he felt like he had gotten his future back. Stories like Harold's are not rare in my practice anymore. They have become the new normal for those willing to make the journey. This is not just anecdotal. The science now backs it up powerfully. The DIRECT trial conducted in the United Kingdom was a game changer. Researchers took people with type 2 diabetes, many of them in their 50s, 60s, and 70s, and placed them on a carefully designed low-calorie weight management program supported by medical teams. at 1 year. Nearly half of the participants had achieved remission. Their blood sugars returned to normal ranges, and they were able to stop their diabetes medications. Even at the 2-year mark, more than a third remained in remission. These were not young athletes. These were everyday people with real lives, real challenges, and real bodies that had carried them through decades. Other research has shown similar encouraging results. When we help the body lose a meaningful amount of weight, particularly the fat stored in and around the liver and pancreas, insulin sensitivity returns. The pancreas can begin producing insulin more effectively again for many people. 10 to 15% of body weight lost is the threshold where these changes become dramatic. That might sound intimidating at first, but when we break it down into small, sustainable daily choices, it becomes achievable even for those of us who are no longer spring chickens. The earlier you begin this work after diagnosis, the better your odds. The pancreas has only so many years it can run in overdrive before its insulin-producing cells start to lose their capacity permanently. But even if you have had diabetes for 10 or 15 years, I have seen improvements that surprised even me. Your body is more resilient than the old medical model gave it credit for. Now, let us talk practically about how this actually works in real life, because knowledge without a clear path does not help anyone. The foundation is always food. I encourage my patients to move away from the processed high glycemic foods that cause rapid blood sugar spikes and instead build their plates around foods that nourish and stabilize. Think abundant non-starchy vegetables, roasted or steamed, dressed with olive oil and herbs, lean proteins like wild-caught fish, chicken, turkey, eggs, and occasional grass-fed beef, healthy fats from avocados, nuts, seeds, and olive oil. These foods do not just control blood sugar, they reduce inflammation, support your heart, protect your brain, and most importantly, they keep you satisfied so you're not fighting hunger all day long. Many of my older patients have found tremendous success with what we call time-restricted eating. This is not about starving yourself. It is about giving your digestive system a longer nightly rest. For example, simply finishing your last meal by 7 p.m. and not eating again until 8 or 9 the next morning creates a 12 to 14-hour window where your body can turn its attention to repair and to burning stored fat. During the night, while you sleep, your insulin levels drop naturally and your body begins to clean house. This single change has helped many of my patients lower their blood sugars more effectively than adding another pill. I know what some of you are thinking. Doc, I've tried diets before and nothing stuck. That is why we focus on habits that fit your real life. We talk about what you enjoy eating, we adapt traditional recipes, we find ways to still enjoy time with family without feeling deprived. One of my patients, a wonderful woman named Margaret, who is 81, still makes her famous Sunday pot roast. She simply adjusted the sides, increased the vegetables, reduced the starch, and eats within her chosen window. Her A1C dropped from 8.7 to 5.9, and she was able to discontinue 2 of her 3 diabetes medications. She tells everyone who will listen that she feels 20 years younger. Movement is equally important, but it does not have to look like what you see on TV. A gentle 20-minute walk after your largest meal can dramatically improve how your muscles use glucose. Your muscles essentially open their doors to sugar even without as much insulin when they are active. If walking is difficult, chair exercises, resistance bands, or swimming work beautifully. The goal is consistency, not intensity. I tell my patients that movement is one of the best medications we have, and it has no negative side effects when done sensibly. Let us talk honestly about medication, because this is where trust between you and your doctor becomes sacred. Never ever stop your medications on your own. I have seen dangerous situations when people do this without guidance. The safe way is to work closely with your physician. As your blood sugars improve through these lifestyle changes, we monitor carefully and taper medications gradually. It is like climbing a ladder back to health. As you get higher, you no longer need the lower rungs that once supported you. Many patients are able to reduce or eliminate several medications entirely, but only when the numbers and their symptoms support it. This process brings its own kind of freedom. Less medication often means fewer side effects, lower costs, and a greater sense of control over your own body. I want to speak directly to the emotional side of this journey. Because at our age, we have earned the right to talk about these things. Many of my senior patients carry a quiet grief about their health. They feel their body has betrayed them. They worry about becoming a burden to their children. If that is you, please hear me. Your body has not betrayed you. It has been responding exactly as biology dictates to the environment and the fuel we have given it over decades. The beautiful truth is that it is never too late to change that environment. Your body is still listening. It is still capable of remarkable repair when given the right conditions. The long-term picture requires honesty as well. Studies following patients for 5 years show that if the weight returns, the diabetes often does too. Some people hear this and feel discouraged. I see it differently. It means your health is not a destination you reach once and forget about. It is a daily relationship. It is a series of small choices that add up to something profound. This is not a diet. This is a return to the way humans were designed to eat and move. When you shift your thinking from I'm on a diabetes diet to I am someone who nourishes my body with respect, everything becomes easier. There will be setbacks, there will be holidays, family gatherings, moments when you slip. That is human. What matters is that you return to your habits with compassion for yourself. I often tell my patients to imagine their health as a beloved garden. You would not look at one weed and decide the whole garden is ruined. You simply pull the weed and keep tending the soil. If you're feeling overwhelmed right now, that is completely normal. You do not have to change everything today. Start with one thing. Maybe it is ending eating after 7 p.m. Maybe it is adding a short walk after dinner while listening to your favorite music. Maybe it is scheduling an appointment with your doctor to discuss a metabolic approach rather than just a medication approach. Bring this video with you if it helps. Tell them you want to explore the possibility of reducing medications safely through sustainable lifestyle changes. Most doctors who stay current with the research will be supportive. We became physicians because we want to see you thrive, not just survive. I have seen people in their late 70s regain energy they had not felt in 20 years. I have watched patients get off insulin, reverse fatty liver disease, improve their arthritis pain, sleep better, and report that their thinking is sharper. The benefits go far beyond blood sugar numbers. They touch every part of life that matters: independence, dignity, joy, and the ability to participate fully in the years we have left. One more story before we finish. I think of Robert, a 79-year-old Korean War veteran who told me he felt like he was just waiting to die when he first came in. His sugars were out of control, his weight had crept up, and his spirit was low. 18 months later, he was in remission, had lost 41 pounds, was hiking with his local senior group, and had reduced his medications to almost nothing. At his last visit, he looked me square in the eye and said, "Doc, you didn't just fix my diabetes, you gave me my life back." That is the kind of outcome I want for every single person watching this. You have more power than you have been led to believe. Your body is not your enemy. It is your oldest and most loyal friend, waiting for the right signals to begin healing. It takes time, it takes patience, it takes partnership with your medical team, but it is possible. The science is clear, the stories are real. The choice is yours to begin. If this message resonates with you, I would love to hear your story in the comments. Have you talked with your doctor about reducing medications through lifestyle changes? What has been your biggest challenge or your greatest victory so far? Your words might be exactly what someone else needs to hear today to take that first step. Thank you for spending this time with me. I do not take it lightly that you chose to listen to a doctor talk about hope when so many voices offer only fear. Keep taking those small, steady steps. Keep believing in your body's capacity to heal. You're worth it. Your family is worth it. The years ahead can still be full of meaning, movement, and joy. This is Dr. Richard Miller, wishing you clarity, courage, and better health with every passing day. I will see you in our next conversation. Until then, stay curious about what your body can do when you give it the right conditions. God bless you, and take good care.